I'm Dr. Caren Reaves with Caring for Women. We have our offices in Denton and Frisco, Texas. I graduated from UT Southwestern in Dallas and went on to do my residency at Parkland Memorial Hospital in Dallas, Texas. My special interests include minimally invasive and robotic surgery, urinary incontinence procedures, and pelvic floor prolapse repair. How will my post-hysterectomy pain be managed? I strive to prevent pain as opposed to simply treating your pain. Typically, I give my patients an injection of a strong anti-inflammatory in their IV before they even wake up, and then aggressively provide pain medication post-operatively. Pain management often depends on the type of hysterectomy performed. For a vaginal hysterectomy, often an anti-inflammatory medication is plenty, or an anti-inflammatory alternated with a narcotic such as hydrocodone. With a robotically assisted or laparoscopic hysterectomy, my patients will get the IV anti-inflammatory, the oral narcotics, but then also an indwelling pump that provides a continuous drip of numbing medicine into the pelvis for about 48 hours postoperatively. Although I rarely perform open hysterectomy, patients would also receive the same pain management as a robotically assisted hysterectomy. Sometimes after an open hysterectomy, a patient-controlled analgesia pump is used. My goal is always to try to prevent pain instead of simply wait for it and then treat it. Often, a patient who has had a vaginal hysterectomy will return to my office and tell me they only took the anti-inflammatory medication for about 1 to 3 days and never even needed narcotics for excellent pain relief. Laparoscopic or robotic hysterectomies may require a little longer, but still usually 3 to 5 days, and then open hysterectomies might require about a week of prescription pain medication. Should I give myself a bowel prep and shave before my surgery? Please do not do a bowel prep unless requested by your surgeon. A bowel prep can be very useful, especially when adhesions, scar tissue, or endometriosis is anticipated. A bowel prep is medication that essentially makes you poop to the point your entire system is cleaned out. If an injury occurs, the bacteria in your poop could cause a life-threatening condition called peritonitis and cause you to have a colostomy bag and need for additional surgeries in the future. The worst thing a patient can do is start a bowel prep and not finish it. If you start one, you must continue until what you're passing is clear like water. It may have color, but there should be no particles in it. Talk to your doctor about whether you should have a bowel prep before surgery and follow those instructions exactly. Similarly, do not shave yourself before surgery. Shaving has actually shown to increase the risk of infection postoperatively because it makes microscopic cuts on the skin. For many surgeries, hair trimming is not even necessary. If it is, we will use clippers in the operating room to clip the hair we need removed. If you do prefer to do your own prep for surgery, use clippers set on their shortest setting, but again, do not shave. I have a lot of anxiety about surgery. What can you recommend? It's normal to be anxious about surgery. I'm actually a little worried about anyone who doesn't feel a little nervous before surgery. For many people, the unknown is scarier than the actual surgery. I like to have my patients come in for a preoperative appointment to go over consents and labs, but my main purpose for the visit is to walk them through the operative day and their recovery, one step at a time. I discuss what to expect from the moment they leave my office to go register, the moment they come in on the operative day, to what to expect after surgery in the hospital, and also what to expect during the home recovery. Knowledge is power. HysterSisters also has an incredible book with lots of information from actual patients on what to expect postoperatively after various types of hysterectomies. There's nothing like hearing it from people who've actually experienced it. If you still have a great deal of anxiety after this, it's not unreasonable to request a mild anti-anxiety medication from your doctor. I'm concerned about intimacy after my hysterectomy. Will it be the same? For many people, intimacy will be even better. Many reasons for a hysterectomy include heavy bleeding and pain. And if a woman is no longer concerned about bleeding or having pain from intimacy, she can usually relax and enjoy the intimate time with her partner even more. The majority of nerve endings responsible for female sexual pleasure are concentrated in the clitoris, labia, and outer 1/3 of the vagina. None of these areas will be affected by a hysterectomy. The orgasm may feel a little different, but again, most of the sensation responsible for orgasm comes from the outer aspects of the female genitalia, not the uterus or the cervix. Sex should not feel any different to a male partner. The width and depth of the vagina is not changed from a hysterectomy. It's important to refrain from intercourse for 6 full weeks after a hysterectomy with removal of the cervix. The incision at the top of the vagina has to heal completely before sex. Having sex too early and breaking those stitches can result in your intestines coming out through the vagina and requiring a trip back to the operating room. Are there any activity restrictions following hysterectomy? Yes. After a hysterectomy, restrictions consist of basically nothing in the vagina for 6 weeks, and no straining, no lifting heavier than 10 pounds for 6 weeks. You'll have some bleeding, but must use pads and not tampons. It's important to refrain from intercourse for a full 6 weeks after hysterectomy if your cervix was removed. The incision at the top of the vagina has to heal completely before sex. Having sex too early and breaking those stitches can result in your intestines coming out through the vagina and requiring a trip back to the OR. Straining from lifting, constipation, or other activity also puts you at risk of breaking these stitches. Constipation from the pain meds can cause straining, so it's important to begin stool softeners if you begin experiencing constipation. One other thing people are very surprised about is the sheer level of fatigue that can last up to 6 weeks after a hysterectomy. Even if it's a minimally invasive surgery, it's still major surgery. And while resting is not a restriction, you sure will get back to normal faster if you try to get rest during your recovery. Listen to your body. If you feel like napping, do it.